This video provides a mock scenario for a rapid response as well as a code blue for a COVID-19 patient. It highlights the following topics during the rapid response in code blue: the roles of the team both inside and outside the patient's room, appropriate use of PPE, effective communication among team members, managing the patient airway to minimize aerosolization or staph exposure, and use or support of the use of the Lucas compression system when available. An 80-year-old woman with a history of hypertension presented with dry cough, diarrhea, headache, and low-grade fevers over the past week. She was diagnosed with COVID-19 on the second day of her hospitalization. She was provided with supportive care and enhanced respiratory isolation. During the morning of her third day of hospitalization, her work of breathing was increasing rapidly. She was transitioned from 6 liters LFNC to 10 liters HFNC to 100% NRB over 6 hours. Shortly after, a rapid response was called on this patient. When any patient emergency requires a rapid response or code blue, team members take action. In the COVID-19 era, proper personal protective equipment is your defense. All staff must wear appropriate PPE in accordance with the Jefferson PPE standard guidelines before entering a patient's room. Only after a designated PPE observer ensures that the PPE is donned correctly is it safe for the rapid response or code blue team members to enter the room.
Steve.
A rapid response team consists of members inside and outside the patient's room. First, let's identify the roles of the team inside the patient's room. Additional members of the rapid response team remain outside the patient's room. These members include Now, let's look at the rapid response team in action. After donning the appropriate PPE, rapid response team members both inside and outside the patient's room work together simultaneously to respond to the call. A nurse from the unit brings the code cart to the outside of the patient's room and passes the monitor to the primary RN. The primary RN returns to the patient to put the monitor on. Please note, the code cart remains in the hallway, but can be taken into the room if deemed necessary by the rapid response team. A communication link is established between team members inside and outside the patient's room using a cell phone set on speakerphone. The patient's room door remains closed with minimize opening. The rapid response team treats the condition at hand and communicates the patient's vital signs to the team outside the room via the communication link. Outside the patient's room, the RN supervisor or nurse manager maintains the communication link, performs crowd control, requests silence from surrounding staff within the hallways, and delegates tasks such as gathering necessary supplies, and will occasionally do tasks as identified on the phone. The holding tank members stand by. The respiratory therapist has the appropriate PPE donned and is ready to enter the room if called. Back inside the room, the patient loses her pulse. The rapid response team begins chest compressions and calls a code blue. Similar to a rapid response, a code blue consists of members both inside and outside the patient's room, but the roles are slightly different. First, let's identify the roles inside the patient's room during a code blue. During a code blue, the team outside the patient's room consists of the following roles. Now let's look at the code blue team in action. The code blue team arrives. After donning the appropriate PPE, team members both inside and outside the patient's room work together simultaneously to respond to the call. The critical care RN brings the code cart to the patient's room. A communication link is established between team members inside and outside the patient's room using the cell phone set on speakerphone. The patient's room door remains closed with minimized opening. Inside, the team begins compressions. The support staff enter the room for compressions. The airway provider and the respiratory therapist enter the room, and the airway provider intubates the patient. The Lucas device is attached, but if it's not available, manual chest compressions are continued. Outside the patient room, the RN supervisor or nurse manager performs crowd control, maintains the communication link with those inside the room, and delegates tasks such as gathering necessary supplies or doing tasks as identified on the phone. Holding tank members stand by as well as pharmacy if applicable. The code documenter remains outside and records the information relayed through the communication link, working closely with the RN supervisor or nurse manager. Remember, all equipment in the room is considered contaminated and must be properly cleaned before removing. Please call the appropriate department for the code cart to be picked up for disinfecting. Make sure to use the hospital-approved disinfectant wipes to clean the code cart prior to it being taken from the patient's room. If needed, transfer the patient following the proper procedures. Take time to don and doff the PPE appropriately. Perform proper hand hygiene and adhere to your assigned role. Please take a moment to review the additional resources found in the Resources tab of this module. Speak with your supervisor if you have additional questions.